School placement can be a very difficult process for families dealing with children who have various degrees of hearing loss. There are many different options available, but choosing the right school for a child is an individual process. Infants who are hard of hearing or deaf have, like their peers, the same capacity to learn language as well as a desire to communicate. This proves that with the right school placement of a child who is deaf or hard of hearing may academically succeed. One must take into consideration the medical needs as well as the modes of communication to decide on the most efficient school placement. In this case, both parents are hearing and they have 3 children with different degrees of hearing loss. The parents have signed with their children since birth.
Hi, I'm Danielle, and I'm here for some assistance in deciding the school placement for each of my children. My oldest child, who's in the 2nd grade, is profoundly deaf and was implanted at 2 years of age. However, she has not been successful with her implant. My second oldest child is hard of hearing, but benefits from bilateral hearing aids. He has developed speech and functional auditory skills. My youngest child will be starting school this year with a hearing loss that is severe.
Hi, I'm Dr. Miller, the audiologist at Vanderbilt.
I'm Danielle. Nice to meet you.
It's good to see you today. I've been reviewing your file, and I wanted to inform you of some medical information regarding your children.
Okay, great.
Well, it's a little more difficult for your oldest child since her implantation at 2 years of age has not reaped any benefits.
Okay, well, is there any way you could give me more clarification on why the cochlear implant isn't working? I just don't really understand what's going wrong.
Of course. As you know, cochlear implants allow deaf people to process and receive sounds as well as speech. And according to Medline Plus, during a cochlear implant, a surgical cut is made behind the ear, and a microscope and bone drill are used to open the mastoid bone, allowing the inside of the implant to be inserted. And Gallaudet University explains that each child with a cochlear implant is unique and there is not one single approach. That is the one approach to develop language and communication for all children with cochlear implants.
Okay, that makes more sense.
With your second oldest, she has bilateral hearing aids, correct?
Yeah, that's correct, and they're working pretty well for right now.
That's good. Good. Well, in the document overview of hearing aids, it explains that bilateral hearing aids help in localizing the direction of sounds, improving listening in noisy situations, and providing better overall hearing.
Our speech skills, have they not developed?
Oh, they have. Your child actually has speech and auditory skills that are fully developed.
Well, that makes me feel better. Is there any hope for my youngest to be fit with cochlear implants?
It's possible, but she's a little older than the average patient receiving them. But according to University of Maryland Medical Center, it is found that deaf children implanted before the age of 5 develop speech and understanding and production very well. It was great meeting you, and contact me if you have any more medical questions. Dr. Jordan will be in shortly to discuss your school placement options.
All right, thanks.
Thanks.
Hi, I'm Dr. Jordan, the speech language pathologist at Vanderbilt.
Hi, I'm Danielle. Nice to meet you.
Nice to meet you. I've been looking over your children's files with Dr. Miller, and we're trying to decide the best mode of communication school placement for your children.
Okay, great.
As you know, communication is the core to a successful life socially, educationally, and vocationally. When determining the most efficient mode of communication for someone, it is important to consider the degree of hearing loss, the age of onset, the current age, and what communication method was exposed during the early acquisition stage of learning. There are a number of methods in which communication is offered. The methods are characterized into categories including auditory, visual, and multimodal.
So what do you think the best school placement or communication mode would be for my children?
In the case of your oldest child who was implanted during the critical development range at age 2 and did not have success, now that he's in 2nd grade, auditory communication is not going to be the most sufficient option, unfortunately. Since you have been signing with your children since birth, ASL would be a great option. The National Institute of Deafness actually tells us that a deaf child born to those who already use ASL will begin to acquire ASL as naturally as a hearing child picks up spoken language from hearing parents. We believe that the best school placement where she could succeed academically, socially, and environmentally would be a residential school where she can take day classes.
Okay, I'll think about that.
Because hearing aids are just an assistive device, continued exposure to American Sign Language along with English will be most efficient. Since he has developed speech and functional auditory skills, attending a regular school would be a suitable option. If necessary, he could attend classes in the resource room. He will be able to use his speech while at school and home, but still will be able to communicate with his siblings using sign language he has learned. For your 5-year-old with severe to profound hearing loss, a solid mode of communication would be American Sign Language. Since the child has already passed the critical early acquisition learning stage, implantation would not necessarily suffice. The American Speech and Hearing Association states that the critical learning language window is from birth to approximately 3 years of age, when brain neuroplasticity is the greatest. Since the American Sign Language was the method exposed during that range for this child, it would be a smart mode of communication. A regular school setting could be best for him since he is still young, and could have an interpreter. If he was not thriving there, he could be transferred to a specialty school.
Well, that's a lot of great information, and thank you so much. It was all really helpful.
Good. And just to reiterate, this is just mine and Dr. Miller's opinion. You know your children best and should make the decision that you and your husband will be happy with. Based on what we know and have found, we think these are the best communication modes and school placements for your children.
Right, thanks.
Okay, well, it was so nice to meet you. Do you have any questions or concerns?
I think you've really touched on everything, but thank you so much.
Okay, and everything Dr. Miller said was clear?
Yeah.
Great. Okay, well, I'm going to give you some pamphlets just in
Okay,
case you
great.
have any further concerns. Please contact me if you think of anything or just want to chat. It was so good to meet you, and I enjoyed talking. Good luck with everything.
Thanks.